Part A. Extract 1. Questions 1 to 12. You hear a rheumatologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Dr. Bobby Manor. I understand you've been experiencing some ongoing symptoms. Can you tell me more about what's been troubling you?
Yes, I've been dealing with a lot of pain in my back and hips, and it's been getting worse over the last few months. Initially, it felt like just regular muscle strain, but now I feel constant discomfort. It's not only when I move, it's there even when I'm lying down or sitting still. Sometimes, the pain radiates down to my legs, making it difficult to walk or even stand for a long period.
I see. That sounds quite uncomfortable. Are there any other symptoms you've noticed recently?
I've also noticed that I'm getting shorter, which is strange. I thought it was just bad posture, but now I'm worried something more serious is going on. I've been feeling unusually tired. I'm not as energetic as I used to be, and sometimes I feel weak, especially in my arms and legs. My bones even feel fragile, like they might break easily. I haven't had any fractures yet, but I'm nervous about it because my balance seems off lately, and I've stumbled a few times.
Those are important details. Let's talk a bit about your medical history. Have you been on any medications or treatments recently?
Yeah, I've been taking calcium supplements for about 6 months, but I'm not sure they've been helping. I was also prescribed ibuprofen for the pain by my GP, but I've been using it only when the pain is unbearable. It doesn't seem to relieve it entirely. I've also tried some herbal remedies, like turmeric and ginger tea, which my friend recommended for inflammation, but nothing's really improved.
Thank you for sharing that. And do you have a family history of any bone-related conditions?
My mother was diagnosed with osteoporosis when she was around my age, and I remember she suffered quite a bit with fractures later in life. My grandmother had arthritis, but no one else in the family has had major bone issues, as far as I know.
Considering your symptoms and family history, osteoporosis could be a possibility here. I understand you might be reluctant to consider it, but your symptoms, particularly the back pain, decreased height, and fatigue, are quite typical of the condition.
I know, but I guess I just didn't think it would happen to me. I'm still relatively young, and I've always thought this was something that affected much older women.
This condition can develop earlier, especially if there are risk factors, like family history or hormonal changes. To be certain, we'll need to perform a bone density scan, also called a DEXA scan. Have you had one done recently?
No, I haven't. I didn't think it was necessary.
We should definitely get that done. It's a quick and non-invasive procedure that will give us a clearer picture of your bone health. Based on your symptoms and history, I suspect that the scan will confirm it, but we'll wait for the results before starting a definitive treatment plan. In the meantime, I would recommend starting a bisphosphonate. This will help slow down the bone loss. I'll also suggest increasing your calcium and vitamin D intake. We may consider hormone therapy if your bone density is significantly low.
I've heard about bisphosphonates. Are there any side effects I should be worried about?
Most people tolerate them well, but some experience gastrointestinal issues like heartburn or nausea. To minimize that, you'll need to take it with a full glass of water and remain upright for at least 30 minutes after taking the tablet. We'll start with a low dose and monitor how you respond to it.
That sounds like a plan. Thank you, Dr. Manor. I'll get the scan done and follow your recommendations.
You're welcome, Mihira.
Extract 2. Questions 13 to 24. You hear a dermatologist talking to a patient called Mihira. You now have 30 seconds to look at the notes. Good morning, Mihira. Could you start by telling me what's been going on?
Good morning, doctor. I've been dealing with these itchy patches on my skin for about 2 months now. It started on my wrists and ankles, but lately, I've noticed it spreading to my lower back and arms. The itching is really intense, especially at night, and it's making it difficult to sleep.
It sounds quite uncomfortable. Apart from the itching, have you noticed any other symptoms, like changes in the color or texture of your skin?
Yes, doctor. The patches are reddish-purple, and the skin feels rough. They're becoming more noticeable, and I feel self-conscious about it, especially since some are on visible areas like my arms. Some of the bumps seem to be merging together, and a few have turned into white streaks. It's really affecting my confidence.
I can imagine how distressing that must be. It sounds like these symptoms are affecting your day-to-day life significantly. Are there any specific activities or situations where it feels particularly bad?
Well, I've been avoiding wearing short sleeves, which isn't great in this weather. Also, the itching is worst when I'm stressed, or as I mentioned, at night. Sometimes, I scratch without even realizing it, and my skin gets irritated and sore.
It sounds frustrating. Just to get a complete picture, do you have any other health issues, or does anyone in your family have a history of skin problems or autoimmune conditions?
I don't have any major health issues myself, but my mother has had eczema for years. My father had psoriasis when he was younger, but it went away as he got older. Other than that, no one else in the family has had anything like this.
Thank you, that's helpful information. Based on what you've told me and from what I can see on your skin, it seems like you might have a condition called lichen planus. It's an inflammatory skin condition that can cause the kinds of lesions you've described. It often appears on the wrists, ankles, lower back, and sometimes even in the mouth. Thank you, that's helpful information. Based on what you've told me and from what I can see on your skin, it seems like you might have a condition called lichen planus. It's an inflammatory skin condition that can cause the kinds of lesions you've described. It often appears on the wrists, ankles, lower back, and sometimes even in the mouth.
I've never heard of that. What causes it?
This isn't entirely understood, but we think it may be related to an overreaction of your immune system. In some cases, it can be triggered by medications, infections, or stress, but often, there's no clear cause. While it's not contagious, it can be chronic and may take a while to fully resolve.
That sounds worrying. How do we confirm this diagnosis?
To be sure, I'll need to perform a skin biopsy. This will help us rule out the conditions. In some cases, we also run blood tests to check for any underlying conditions that might be contributing to the symptoms.
Okay, and what happens after that?
We'll start treatment after confirming the diagnosis. The primary goal is to reduce itching and inflammation. I'll prescribe a topical corticosteroid cream, which you'll apply to the affected areas twice a day. This should help calm the inflammation and reduce the itching. If the symptoms are severe, we might need to consider oral corticosteroids to help with the itching.
How long will the treatment take? Will it completely go away?
That depends on how your body responds. With treatment, symptoms typically improve in a few weeks, but in some cases, it can take months. The condition can go into remission, meaning the symptoms might disappear entirely, but there's also a chance it could recur later. We'll monitor your progress closely and adjust the treatment if needed. The corticosteroids are generally safe for short-term use, but there are potential side effects like skin thinning if used for extended periods. If oral medications are needed, we'll also need to watch for side effects like weight gain or increased blood pressure.
Thank you, doctor.
You're welcome, Mihira. That is the end of Part A. Now look at Part B.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a doctor called Mihira talking to a junior doctor. Now read the question.
Dr. Peter, today we'll discuss the proper use of a defibrillator. This life-saving device is essential for treating cardiac arrest.
I understand. I've seen defibrillators used in movies, but I'm not sure about the actual procedure, Dr. Mihira.
The first step is to ensure the patient is unresponsive and not breathing. Then, turn on the defibrillator and follow the prompts. The device will analyze the patient's heart rhythm and determine if a shock is necessary.
What if the defibrillator advises against shocking the patient?
If the patient's heart rhythm is not shockable, we'll need to perform cardiopulmonary resuscitation, CPR, until medical assistance arrives.
Are there any precautions to take when using a defibrillator, Dr. Mihira?
It's important to ensure the patient is dry and free of any metal objects before applying the defibrillator pads. Also, be careful not to touch the patient during the shock.
Now look at question 26. You hear a nursing manager called Mihira conducting a morning meeting. Now read the question.
Good morning, team. Today, I want to discuss the upcoming implementation of our new electronic health record, EHR, system. This system will streamline our workflow, improve patient care, and enhance communication between departments.
I'm excited about the new EHR. What are some of the key features, Mihira?
The EHR will provide real-time access to patient information, including medical history, medications, and vital signs. It will also streamline the documentation process and reduce errors.
I'm concerned about the learning curve. Will there be sufficient training to get us familiar with the new system?
We've planned comprehensive training sessions to ensure everyone is comfortable using the EHR. There will also be ongoing support available if you have any questions or encounter difficulties.
Mihira, will this new system affect our workflow significantly?
There may be some initial adjustments as we adapt to the new system. However, in the long run, the EHR will improve efficiency and reduce administrative burdens. Now look at question 27. You hear a junior nurse called Mihira talking to a head nurse. Now read the question. Nurse manager, I'm concerned about Mr. George's condition. His blood pressure is dropping, and he seems to be becoming increasingly lethargic.
That's concerning Mihira. Let's assess his vital signs and notify the doctor immediately.
I've already taken his vital signs. His oxygen saturation is also low. I believe he might be experiencing a medical emergency.
We need to act quickly. Let's prepare to administer oxygen and call the rapid response team.
I've already notified the team. Should we also prepare for intubation?
It's a possibility. Let's monitor his respiratory status closely and be prepared to intubate if necessary.
I'll also notify Mr. George's family about his condition and the need for further evaluation.
That's important, Mihira. We'll need to provide them with updates and answer any questions they may have. Now look at question 28. You hear a pharmacist called Mihira talking to a doctor. Now read the question.
Dr. Peter, I'm reaching out to discuss a change in our medication suppliers. Due to recent supply chain disruptions, we've had to adjust our sources for certain medications.
I understand, Mihira. How might this affect our patients' access to medications?
While we're working diligently to maintain consistent supplies, there might be temporary delays or changes in medication brands. It's important to communicate these changes to patients and ensure they're aware of any potential alternatives.
That's crucial. How can we minimize disruptions for our patients?
We're working closely with our new suppliers to ensure timely deliveries and maintain adequate inventory levels. We're also exploring alternative sources for medications that might be in short supply.
Are there any specific medications that might be affected by this change, Mihira?
We've identified a few medications that may experience temporary shortages. I'll provide you with a list and recommend alternative options if necessary.
Now look at question 29. You hear a GP called Mihira talking to a nursing manager. Now read the question.
Nurse manager, I'm admitting Mr. George to the ward. He's presenting with acute chest pain and shortness of breath. His vital signs are unstable, and he requires immediate attention.
I'll prepare a bed and notify the team, Dr. Mihira. What are his current medications and allergies?
He's on a blood thinner and has a history of asthma. Please ensure he has access to his medications and an inhaler.
I'll coordinate with the pharmacy. Is there anything else we should be aware of?
Mr. George is a fall risk, so please ensure his bed is in the lowest position and the call light is within reach. We'll need to monitor his vital signs closely and be prepared to respond to any changes.
I'll assign a dedicated nurse to Mr. George and ensure he receives the necessary care. Is there anything else you'd like me to know, Dr. Mihira?
Please keep me updated on his condition and any changes in his vital signs. We may need to adjust his treatment plan based on his response.
Now look at question 30. You hear a physiotherapist briefing the need of equipments in the facility. Now read the question.
Team, I'm reaching out to discuss the urgent need for additional physiotherapy equipment to meet the growing demands of our patients. We've seen a significant increase in referrals, and our current equipment is insufficient.
That's concerning, Mihira. What specific equipment do we need?
We require more exercise bikes, treadmills, and resistance bands. These are essential tools for rehabilitation and strengthening exercises. Additionally, we need to invest in newer models of ultrasound therapy machines for pain management and tissue healing.
I agree. Our current equipment is outdated and not meeting the needs of our patients.
The lack of adequate equipment can hinder our ability to provide effective therapy. We need to advocate for increased funding to acquire the necessary resources.
How can we prioritize the equipment needs and ensure that we're allocating resources efficiently, Mihira?
We should conduct a needs assessment to identify the most critical equipment requirements based on patient demand and clinical outcomes. This will help us prioritize our requests and allocate resources effectively.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between an endocrinologist, Dr. Mihira, and an interviewer. Thank you for joining us today, Dr. Mihira. Could you tell us what your current research on Addison's disease is focusing on?
Absolutely, and thank you for having me. My research is centered on a multifaceted approach to understanding the nuances of Addison's disease, particularly focusing on how the adrenal insufficiency manifests differently among various demographic groups. We've discovered that the underlying causes aren't as uniform as traditionally thought. While the disease itself results from the immune system attacking the adrenal cortex, we've observed variations based on genetic factors, environmental triggers, and even the patient's stress response systems. The study also aims to delineate these distinctions clearly, with a focus on the often overlooked non-classical symptoms of the disease, such as chronic fatigue, joint pain, and digestive issues. This has been an exciting area to explore because it sheds light on why some patients respond differently to conventional treatments. In a broader sense, we're re-evaluating the disease's progression, with the hope that we can develop more personalized treatment options.
That sounds fascinating. How did this particular study begin, Dr. Mihira? What sparked your interest in this area of research?
The genesis of this study was rather serendipitous. Initially, we were working on a large-scale autoimmune disease project that included several disorders, not just Addison's. What piqued our interest was the alarming rise in misdiagnosed cases, which led us to question if the current diagnostic criteria were too narrow. During a routine data review, we realized that patients with Addison's disease often present with ambiguous symptoms that overlap with other autoimmune disorders, such as lupus or even chronic fatigue syndrome. We started narrowing down on Addison's when we found significant gaps in the early detection processes. However, it wasn't until we delved into patient histories that we truly began to grasp the complexity of the disease. We saw that many patients underwent years of suffering before receiving the correct diagnosis. This delay often exacerbated the disease progression. So, we redirected our focus, making Addison's the core of our study. We began by collecting comprehensive data from over 200 patients across various geographic regions to get a more diverse picture of the disease.
With such an intricate subject, I imagine you must have faced a number of challenges. Dr. Mihira, could you elaborate on some of the hurdles your team encountered during the study?
Indeed, the challenges have been substantial. First and foremost, one of the biggest obstacles has been the variability in symptom presentation. Addison's is notorious for mimicking other disorders, and this variability makes it difficult to create a uniform diagnostic model. Some patients show the classic signs like hyperpigmentation and low blood pressure, but others might only report fatigue and gastrointestinal distress, which are nonspecific symptoms. Another challenge has been patient accessibility, especially in terms of obtaining longitudinal data. Addison's is a relatively rare disease, and convincing patients to participate in a long-term study can be difficult. We also faced issues with the availability of advanced diagnostic tools in remote or underserved areas. One of our goals has been to overcome these geographical and socioeconomic barriers, but it has certainly complicated the process. Moreover, developing a standardized protocol for early detection that can be universally applied is no small task. We are trying to create a framework that adapts to different healthcare settings, which requires a lot of customization and constant revision.
Given these obstacles, have there been any notable recent developments in your study, Dr. Mihira?
Yes, we've made some promising strides lately, which is exciting. The most recent development has been the identification of a new biomarker that could revolutionize early diagnosis. This biomarker, which we discovered through genetic profiling, seems to be present in patients well before clinical symptoms become apparent. The implications are huge because, for the first time, we could potentially detect Addison's disease before adrenal damage becomes irreversible. Additionally, we're testing a novel imaging technique that uses advanced MRI technology to visualize adrenal gland inflammation in its earliest stages. This could significantly change how we approach both diagnosis and treatment because the current methods, like blood tests and ACTH stimulation tests, are reactive rather than proactive. By catching the disease earlier, we hope to improve patient outcomes dramatically. That's remarkable. Dr. Mihira, what are the expected outcomes from this study, especially given these advancements?
We have high hopes for the outcome of this research. If all goes as planned, we anticipate a major shift in the way Addison's disease is diagnosed and managed. The goal is to move towards preemptive care, meaning we can start treating patients before their adrenal glands are severely compromised. With our findings, we're hoping to establish new guidelines for early screening, particularly for at-risk populations. These would include individuals with a family history of autoimmune disorders or those who exhibit certain genetic markers. Ultimately, we expect that earlier detection will reduce the need for lifelong hormone replacement therapy, which comes with its own set of challenges, like balancing cortisol levels. We're also optimistic that this study will pave the way for targeted therapies that address the root causes of the disease, rather than just managing symptoms.
What kind of long-term impact do you think this study will have on the field of endocrinology and patient care? The long-term implications could be quite profound. First, on a clinical level, if we can implement these early detection methods, it would drastically reduce the morbidity associated with Addison's disease. Patients would no longer have to endure the years of misdiagnosis and untreated symptoms that often lead to critical adrenal crises. But beyond that, this research could potentially reshape how we approach other autoimmune conditions. By focusing on biomarkers and genetic profiling, we're exploring a new frontier in personalized medicine. This study might serve as a model for diagnosing other diseases before they fully manifest. Moreover, from a healthcare system's perspective, earlier diagnosis could reduce the overall burden on healthcare services by preventing the complications that come with late-stage disease. There's also the possibility that our findings will lead to new drug development, specifically treatments that could halt the autoimmune attack on the adrenal glands before they become irreversibly damaged. It's an exciting time to be involved in this work, as it feels like we're on the cusp of real change. Now look at Extract 2. Questions 37 to 42. You hear an oncologist, Dr. Dennis Watson, talking about the unforgettable journey in his career. You now have 90 seconds to read questions 37 to 42. One of the most unforgettable patients I've had the honor of treating is Mihira, a young woman who came into my clinic with a situation unlike any other. What makes her case stand out isn't just her diagnosis but the personal context surrounding her. Mihira was a 32-year-old mother with a newborn, just 5 days old, when she received the devastating diagnosis of stage 2 breast cancer. Imagine the emotional and physical toll of being a new mother, coupled with the news that you have a life-threatening illness. Her baby was not yet weaned, and the thought of balancing her role as a mother with the grueling fight against cancer added layers of complexity that left a profound impact on me. The intense bond she shared with her infant amplified every discussion about treatment and outcomes. She feared losing time with her newborn or being unable to provide care, which gave every decision a weight beyond the usual considerations. It was this juxtaposition, of the joy of new life clashing with the threat of cancer, that etched her deeply into my memory. The human element in medicine, her experience, made it impossible to see her as just another patient. Mihira's situation presented one of the most complicated decision-making scenarios I've faced. The nature of her breast cancer, though treatable, required immediate and aggressive intervention. Standard treatment protocols would typically involve chemotherapy, radiation, and potentially a mastectomy. However, Mihira's recent childbirth and her desire to continue breastfeeding posed additional challenges. Breastfeeding during chemotherapy is usually contraindicated, as it exposes the child to harmful chemicals through breast milk. Yet, Mihira was incredibly determined to provide the best for her newborn, which meant continuing breastfeeding as long as possible. This put me in a moral and professional quandary. Should we prioritize immediate and aggressive chemotherapy, effectively forcing her to stop breastfeeding her baby, or should we modify the treatment plan, giving her a brief window to nurse before treatment? We had to weigh the risks of delaying chemotherapy against the potential harm to her child. The decision wasn't easy because the stakes were incredibly high for both her and her infant. In the end, We compromised on a short delay in chemotherapy, with close monitoring of her tumor markers, allowing her to breastfeed for an additional 2 weeks before starting treatment. This balance required constant coordination with pediatricians, lactation specialists, and oncologists to ensure no one aspect of her health or her baby's was overlooked. Supporting Mihira through her treatment plan involved more than just clinical decisions. It was about offering emotional, psychological, and holistic care that could sustain her both physically and mentally. I knew from the beginning that the emotional burden would be overwhelming. She was transitioning into motherhood, a journey that is exhausting in itself, without the additional pressure of cancer treatment. First, we put together a team of counselors and social workers who specialize in working with new mothers dealing with illness. We also connected her with other women who had been through similar experiences, forming a support group that allowed her to share her fears and challenges. The goal was to ensure that Mihira never felt alone on this journey. In terms of treatment support, I worked with her to adjust the timing of her chemotherapy around the needs of her newborn, scheduling her sessions when she had family available to care for her baby. We discussed fertility preservation options as well, to ensure that her future reproductive health was not compromised by the harsh treatments. Through ongoing communication and trust, my plan was to make sure she had the emotional resilience and practical resources to manage her role as a mother while undergoing treatment. Managing Mihira's case required extensive coordination between multiple specialties. Oncologists, pediatricians, lactation consultants, fertility experts, and social workers all had vital roles in ensuring she received the best care. The oncology team focused on her cancer treatment, recommending chemotherapy protocols that minimized side effects as much as possible, while the pediatric team advised on the safest way to balance breastfeeding and treatment. Lactation consultants helped her transition from breastfeeding to alternative feeding options for her newborn, while fertility specialists offered consultations on preserving her ability to have children in the future. Each of these professionals had their own expertise, but they all worked together under one central plan for Mihira's health. Weekly meetings were held to discuss any changes in her treatment response or the well-being of her baby, ensuring that every decision was made with the full picture in mind. My role was to synthesize all of this information and ensure that Mihira's care plan remained cohesive, taking into account her physical and emotional health alongside her role as a new mother. After months of close coordination and intense treatment, the results of our collective efforts were highly encouraging. Mihira responded remarkably well to the chemotherapy, and we achieved significant tumor reduction after the first few rounds. She completed her course of chemotherapy and underwent a successful lumpectomy. Even though she had to stop breastfeeding earlier than she had initially wanted, her baby remained healthy, thanks to the proactive involvement of pediatric care. What stands out the most is that despite the initial fears and setbacks, Mihira was able to bond with her child and focus on recovery. Her resilience was astounding, and by the end of the treatment, her cancer was in remission. This outcome reaffirmed my belief in the importance of holistic and patient-centered care, where the focus extends beyond the disease to the person's entire life. In reflecting on my career, Mihira's case has left an indelible mark on how I approach complex patient care. It reminded me that while cancer treatment is grounded in science, it is the human elements that truly define a physician's role. Her case stretched me to balance clinical rigor with empathy, to juggle not just medical data but also the patient's emotional world and family life. More importantly, it reinforced the value of teamwork and multidisciplinary collaboration in achieving successful outcomes. This case has become a landmark for me, not only because of its complexity but also because it highlights the importance of treating patients as whole individuals, not just as medical cases.
That is the end of your OET listening test. Now check the answers.